And in particular, there's a form of malnutrition called stunting, which is when children are particularly short. And this is the most common form of child malnutrition in the world. And Guatemala is one of the unfortunate leaders in that form of malnutrition. In the Maya communities where we work, more than 70% of children are stunted or suffer from that form of malnutrition. So it really is the sort of the base state of the population, and it's something we sort of grapple with on a daily basis.
Welcome to Zestful Aging, where I speak with changemakers from all over the world, from every walk of life, who will inspire you to live with zest. I'm your host, Nicole Christina, and my mission is to bring you optimism about aging and help you make full use of the new opportunities that only come at this stage of life. To find out more about this podcast, hop on over to zestfulaging.com. Did you know that there are more than 7,000 human languages in the world? Of these, more than about half are in danger of disappearing within a few generations. Guatemala, a small country in Latin America, has one of the largest indigenous populations in the Americas and more than 20 indigenous Mayan languages. Today, we're going to learn about what is causing languages to be in danger there and how this affects the health and well-being of the Maya people who speak them. Our guest is Dr. Peter Rohloff, the co-founder of the Maya Health Alliance, a primary care organization working with indigenous Maya communities in rural Guatemala. Welcome to the show.
Thanks for having me. It's great to be here.
You told me when we first met that yours is a coming of age story. Can you talk about how you found yourself in rural Guatemala?
Sure. It's kind of like, as you say, sort of circumstantial, serendipitous. This goes back to the early 2000s. I had sort of just finished my doctoral work, and I was kind of in the process of going to medical school or starting medical school, and was kind of looking for a change of scenery, sort of a perspective on the world. And I had some friends who were working in Guatemala. I thought, I'd like to learn Spanish. That sounds like a good thing to do. So I came here. And it was a really eye-opening experience for me in a lot of ways. But the main thing was the disconnect between my uninformed, preconceptions of what Guatemala was, and then what it was when I got here. Principally, I thought of it as like a nice tourist destination, a place where you come to learn Spanish. And then I got here and was really just taken by the rurality, the extreme rurality of the country, the extreme disparities, and the fact that, in fact, a very substantial portion of the population doesn't speak any Spanish at all. Mm-hmm. And so I thought, what is it about my own sort of upbringing, education in the world that, I would come to a place and not know these things in advance, And so it just got me thinking a lot about my responsibility in the world, my need to be educated and informed. And respectful of the people I interact with and the places I go. And it was sort of like the start of, early young adult start to those values, which I've tried to sort of adhere to now throughout my adult life.
Did you grow up in the Midwest? I saw that you went to school in the Midwest.
I grew up in Vermont. My parents moved the family to Vermont when we were, I think I was in maybe third or fourth grade. So, and then I was in Vermont for most of my life. I went to undergraduate school in Vermont. And I moved to the Midwest for graduate school and medical school.
I see. And Vermont might be one of the whitest states in the Union.
Exactly. Yeah. It's just such a, it's so wonderful in so many places, but it's incredibly insular. And I sort of grew up in, what we used to call the real Vermont. This is sort of like, pretty poor working class Vermont without a lot of interaction or travel. And that was sort of my reality up until I left to graduate school. So,
and you went to a school that was primarily a military school. Is that accurate?
Yeah, I went to Norwich University. Is is one of the sort of bigger private schools in Vermont, but was founded, I can't even remember when, a long time ago, as a private military school. It actually predates West Point and the other sort of, U.S. federal affiliated military schools.
Mm-hmm.
And then, over the years, it sort of diversified, and I was not in the military and didn't participate in the sort of military components of the campus. But I graduated from high school quite early. I was pretty young, and so it was an opportunity to, go to sort of a decent bachelor's of science program close to home, without leaving the state. So that was kind of the.
Just occurred to me that might have been a different sort of feel than ultimately, you end up now in rural Guatemala. And maybe I'm making some assumptions, but it didn't sound like your early years were really pointing you in the direction where you ultimately ended up.
No, in fact, I would say my early years were sort of not pointing me really in any direction. It
Ah.
was just kind of rural, insular, white, working class Vermont,
Mm-hmm.
and not really a lot of kind of like, I sort of think I always kind of thought I wanted to be a physician. That was kind of like the general direction I was going in, but I wouldn't sort of characterize my adolescence, high school, and early adult life as like informed in any way. It was just
Mm-hmm.
kind of drifting or happenstance.
Mm-hmm. And so now it sounds like you really have a laser focus and have really devoted much of your life, and certainly your professional life, to educating us on some of the challenges of indigenous populations, particularly in Guatemala.
Yeah, and I think that's right. And I've been, I feel very fortunate to have found a thing to do that is focused and feels meaningful, and feels like an area where I can contribute both in terms of, improving health of population, but also, providing some wider education to, the world at large.
Mm-hmm. I noticed that some of your research looks at malnutrition. Is that one of the bigger problems in Guatemala where you are?
Yeah, absolutely. So Guatemala has one of the highest rates of child malnutrition in the world. And in particular, there's a form of malnutrition called stunting, which is when children are particularly short.
Mm.
And this is the most common form of child malnutrition in the world. And Guatemala is one of the unfortunate leaders in that form of malnutrition. In the Maya communities where we work, more than 70% of children are stunted or suffer from that form of malnutrition. So it really is the sort of the base state of the population, and it's something we sort of grapple with on a daily basis.
And what is going on? And excuse my ignorance here, but what is going on that in the food system or lack of food system that is reinforcing this problem? Why the malnutrition?
Yeah, so stunting is a social disease, right? It's basically a disease of deprivation and lack of access to resources. And it's complicated. It's not just a simple matter of saying, there's not enough food. In fact, there tends to be enough food in Guatemala, at least in terms of calories. But the problem is that children don't have access to good foods. So they tend to eat a mixture of fairly bland, carbohydrate-rich foods without a lot of without a lot of vitamins and minerals in them. And so
Mm-hmm.
it's a diet that's of very low quality, although
Mm-hmm.
is sort of enough to keep them alive. So there's that. Then there's the chronic exposure to waterborne illness, so things in the water that cause diarrhea, that lead to these sort of fits and starts and growth every time the child gets an acute episode of diarrhea.
I
Uh,
see.
and other factors as well, but it's sort of a disease of poverty, of the lack of a social safety net, with all of the components like, limited
Mm.
education, limited access to clean water, limited access to good health care.
Reminds me of the Native American populations who heavy carb, heavy diabetes.
That's a good parallel, and in fact, we have a lot of diabetes in adult Maya individuals in Guatemala. The causes of it are slightly different than in the sort of the North American indigenous population, but there's
Mm-hmm.
certainly some overlap. And exactly this thing about how the food environment has been perverted or distorted by colonialism and
Mm-hmm.
outside forces and the disruption of native food systems is like a big part of it.
Mm-hmm. So what is your day like? I know you are writing grants and that, but in terms of a day to day where you're, not writing grants or traveling back to Massachusetts, what does it look like for you?
Yeah, so I've recently actually transitioned my role here in Guatemala. I used to be chief medical officer of this organization, which had a lot to do with overseeing patient protocols, and over the last few years was almost completely about overseeing our COVID response. But more recently, I've transitioned into a science role, so I'm sort of the chief science officer. So in that role, I mostly coordinate our research arm, which
Mm-hmm.
is the studies we're doing related to malnutrition and other conditions. So in a typical week, I might spend 2 days in the research office, kind of working with our team of researchers. We've got about 20 researchers here, so it's sort of like small touch points on all the different projects, helping them sort of correct course or troubleshoot problems they're having in their research projects. And then I usually spend about one day a week writing reports or doing data analysis, which sounds incredibly thrilling, I'm sure. And then usually I spend one day a week in the field, which is either seeing patients or visiting our research programs or being in one of our regional offices and meeting face to face with staff members that I don't see on a weekly basis. So that's it. And I only work 4 days a week here. I've really tried to also maintain some quality of life. So I work 4 long days and then I take a long weekend every week. So
Mm. Hi, Zesties. Hey, if you're enjoying this episode, I would so appreciate if you would share with just one person, like a family member or a friend who would enjoy and benefit from Zestful Aging Podcast. Thank you so much. Talk about some of your activities because from what I know and what I've seen, you really love hiking and birding and things having to do with nature outdoors. Can you talk a little bit about how that is in Guatemala?
yeah, absolutely. So yeah. So I think hiking is definitely sort of my main recreational passion. And this goes back to my childhood, and like one of the really great things about Vermont was exposure to the outdoors. But, I sort of recovered my commitment to hiking sort of in the last 10 years or so, and I've really made it a big focus. Here in Guatemala, we have just incredible hiking, especially because we have all of these volcanoes. And I live in Antigua. My house is in Antigua, which is, really within spitting distance of three huge volcanoes. So
Mm.
I spend, pretty much one day a week on the volcanoes, hiking different trails. And sometimes I take people up the volcanoes, like as sort of guiding, and sometimes I just go on my own. Sometimes I take my dog. It sort of depends on the mood. But it's wonderful, and the birding is also amazing. Birding is something I'm new to. I discovered birding, I guess, in during COVID. When I was looking for additional activities, and yeah, it's been really great to over the last 4 or 5 years to familiarize myself with the birds of Guatemala and also to become attuned to the migration, right? Because we are a big overwinter location for birds
Mm.
from North America. So you
Mhm.
get these big waves of birds coming and going, and
Oh,
it's really exciting.
gosh, that
Yeah.
must be. Do you find that there are people who come down that are hardcore birders to see that process, to see them coming down to get food?
Yeah, I think there is a lot of bird sort of tourism in Guatemala. I
Mm.
think it's more about catching the birds that are here all the time, because
Ah,
most of the birders who come to Guatemala are from North America, so they're familiar with the birds that migrate into Guatemala.
yes.
Um, but for example, hummingbirds, right? So there's only one species of hummingbird that migrates into North America, right? The ruby-throated, right? But in
Ah,
but in Guatemala, in addition to the ruby-throated, which we get during the winter season, we have a dozen other hummingbirds.
oh my
So
goodness.
so people will come just to see hummingbirds that they wouldn't otherwise have the chance to see. So things like that.
It's funny, when I was in Costa Rica, I was struck by, wait a minute, that's a green heron. We have those. And it was just exactly that, that they were coming down to get some food. But some of them were my local birds, and I was surprised to see them. This is maybe an assumption on my part as a social worker, just sort of wondering, you're working with some pretty big broken systems. And I wonder if some of your love for nature and the birding, does that help some of the frustration that you might feel about uh, what's going on with some of the populations that you're working with?
Yeah, it's a really great question, and it's one that's actually really pressing in my own mind right now. Just as essentially, how do you sort of maintain vigor and hope and clarity and energy? And I'm finding, like, in this phase of my life, that's a major sort of psychological task or spiritual task that I'm only that I don't think I was prepared for, or it's sort of taken me by surprise a little bit. I think in the first sort of half of my career, I don't know, I was just sort of like carried along by optimism, or just, I don't know, youthful biological energy capacity. I don't know what it is, but especially post COVID, I've sort of there has been a lot of questioning. Just like, what am I doing? What is the
Mm,
point? All these sorts of things, and I found, like, those are signs, not that the work has changed fundamentally in terms of meaning, but that my I need to find ways of renewing my own sort of sense of commitment and my own sort of energy. And so, yeah, I think uh, hiking, birding, working less, working more intentionally, sort of trying to tackle the inevitable busyness of um, of the kind of work that we do, and make it less busy. Those are all things that I'm, like, working really hard on as I try to think about, what do the next 5 or 10 years look like. And, I want them to be different, substantially, qualitatively different, less busy, less noisy, more focused on my own sort of personal trajectory, and not feel like I'm burning the candle, at both ends, the proverbial candle at both ends.
yeah, it reminds me of burnout. You're describing that sort of the cynicism kind of creeps in, and it's hard to stay. Yeah, it's hard to stay energized.
Yeah, exactly. Exactly. Yeah. So that, and we've been Rebecca, my partner, and I have been really engaged with Buddhism as well over the last 5 or 6 years. And I think that
Mm,
that's also been, like, a tremendously useful, still ongoing, but tremendously useful new source of perspective, just helping to sort of tackle and deconstruct, what we would call attachment, like all these sort of
mm.
these psychological processes that are a little unconscious, but that drive your personality or construct your reactions to the world. And I want to be less reactive. I want to be more engaged and mindful and present. And so that's been a big focus, over the last few years.
I was thinking about preparing for the interview, and one of the things that I wondered about is what it's like. I know that you spend a lot of time on airplanes and you teach at Harvard, and I wonder what it's like to go. I mean, you want to talk about two extremes, two polar extremes, and how it is for you to be teaching Harvard medical students and then going back, who among them are the most entitled population possible, and then going back to kids who are stunted because they don't have enough food. How do you kind of reconcile that?
I mean, I think it's been, on the whole, I think that's been a really stimulating and enjoyable part of my career. Although
Mm,
with one caveat that I'll get to, I would say, I'm in the division of global health at one of the Harvard hospitals. So like my peer group is doing similar things, and
mhm,
the trainees that I interact with, either master's degree students or medical residents or medical students, are all sort of coming to me generally with a sort of declared interest in the kind of work I do. So
mm,
I find like there's a lot of opportunities to teach these kinds of values. And when I'm on service attending in the hospital in Boston, I try to focus. I do focus on the whole person, on the social sort of determinants of their health and well-being, and those are things that I've learned how to manage well here in Guatemala, and I feel like I can translate those skills into the Boston environment. So I would say on the whole, it's been good. I would say the thing that I struggle with most, and this is again a sort of a post-COVID thing, is just this: when I go back to Boston, this sense that man, the healthcare system in the U.S. is just in such shambles,
mhm,
and it's in, clearly so after COVID. Just this inability to like mount a meaningful, sustained response to meet the needs of the poorest and the most vulnerable. And and so you go back, and it's really tough to combat that sort of feeling that you're putting band-aids on this thing that just is fundamentally difficult to fix. So I am sort of recently struggling a little bit more with that. When I go back to Boston, it's, oh my gosh, it's just like I
mhm,
feel almost somewhat a little bit more rudderless sometimes there than I do
mhm,
here in
mhm.
Guatemala, where it seems to me like there's more hope and there's more optimism and there's more social resilience despite all of the problems. So
That's very interesting. Yeah. Is it I'm just trying to understand, like, does it take you a few days to settle back in? I mean, what's that like going back and forth for you? What's the whole body experience like?
yeah, I don't do it nearly as much as I used to. So when in the early days, like 20 years ago, I was sort of basically traveling every week or every 2 weeks, and so Um, and then, I just, the whole body experience is basically that, as you age, you're just not, your circadian rhythm is just not supple, just not supple, right? So I've learned, for example, that I really need a full day on either end of a trip.
Mm,
That's the main thing.
mhm,
It almost doesn't matter where I'm going or how many time zones I'm crossing. I try to just schedule a full 24 hours on both ends to just recover and relax and be like compassionate with myself and not make that period of time filled with work, and that really helps a lot. And then I find that if I build that time in, then I'm sort of fine and I can jump right into the work.
mm.
But that's a lesson I've learned. That you can't just run from one environment into the other and expect to be functioning well. So.
Mhm, mm. Is there anything you would like to share with our audience who are all over the world? We're heard in 106 countries. I- is there anything you'd like them to know that I haven't asked you about Guatemala or the environment or what's going on there that people really don't understand?
Yeah, I mean, I think, um, I would just say, there's Guatemala and other countries around Guatemala have been in the news a lot recently over the last 4 or 5 years because of migration to the United States and to Mexico. And I think your listeners all over the world will be aware of these stories.
Mm-hmm.
And and I think it's an important human story to keep an eye on. And I think just remember that people don't leave their country because they want to. They leave their country sort of because they feel that they have to, and part of, and most of these people who are leaving are indigenous, not all, but most of the people who are migrating to the United States from Guatemala are indigenous, and they're leaving because they don't feel like they have the opportunities in Guatemala that they need um, to have the lives that they want, and they want to provide and support their families into a better life. And I think that's an important story to keep an eye on, and to think about what can we as world citizens do to, support the rights of people to stay in their countries of origin, and what can we do to help individuals in these different environments feel like they don't need to leave. And climate change is a big part of this too. A lot of in Guatemala and in Honduras and many of these other locations that are migrating to the north, a lot of these individuals are farmers, and so they're finding that with the increased frequency of severe weather events or with droughts as a result of climate change, these events really impact their ability to have safe and sustainable livelihoods. And so I think it's incumbent on all of us as world citizens to really think hard about how climate change is impacting the health and vitality of rural farmers around the world. It's a big problem, I think that there are a lot of countries around the world where you don't hear the stories, but Guatemala is a good example of where we are hearing some stories, and I think we should pay attention to that signal.
Mm-hmm. Yeah, that's such an important point, that this affects everyone. And to have a sort of a wider understanding of what's going on in the world, for sure. Peter, where can people find out more about the clinic and you and the initiatives that are going on here?
Yeah, we have a website. Our organization is called Maya Health Alliance. And so we have a website, which is www.mayahealth.org.
Okay.
So if you go to that website, or you've just Googled Maya Health into your Google search bar, you'll find it. And it's a nice website. You can read the bios of all of our staff members, all of our research projects, and all of our sort of scientific and technical publications are up. And lots of details about our work, lots of videos, lots of photos. So that would be a good place to go to learn more.
Yes, it's a lovely website. And I just wanted to do a shout out to Laura Reeder. Thank you, Laura, for introducing me to Peter. We took a lovely walk in upstate New York, and she talked about her recent visit and how beautiful it was, and the good work you're doing. So shout out to Laura. And I really appreciate your time today. I know you've got a lot going on, and I wish you the best of luck in all of the work.
Well, thanks again for having me. It was really nice to be able to talk.
Thank you so much for joining us on Zestful Aging. To find out more about this podcast, hop on over to zestfulaging.com. And while you're there, sign up for my email newsletter, The Insider, where you will get fun and quirky tidbits about the show and my exploits, including when I went python hunting in the Everglades with one of my guests. And if you love the podcast, I'd be grateful if you shared it with your friends. And check out my new YouTube channel, where you will find never before heard bonus episodes at Zestful Aging 132. Our music is courtesy of Judy Banker, who was a previous guest on the show. Find out more at judybanker.com. And our technical director is Stephen Litweiler. And stay tuned next week for another interview with a fascinating and inspiring guest.